MeraDoc is a 24 into 7 holistic, tech enabled healthcare delivery platform with family physicians as a gatekeeper of the entire healthcare ecosystem. Cancer remains one of the leading causes of death worldwide, affecting millions of individuals and their families each year. However, there is hope. By understanding the risk factors, recognizing early warning signs, and making informed lifestyle choices, we can significantly reduce our risk of developing cancer. And today, we are here to learn the same. In the panel today, we have with us Dr. Colonel Sanjay Kumar Singh, who has specialization in family medicine and is currently the head clinical services at MeraDoc. Dr. Sanjay has 32 years plus of experience as medical officer and administrator and has served in various hospitals of armed forces all over India. He has also been a pioneer of medical mission in Afghanistan. So with this, I would welcome Dr. Sanjay on the panel. Thank you so much, sir, for being there for the webinar.
Thank you, Vanshika, and a very good afternoon, good evening to everyone, to our listeners. Today, we'll be talking about cancer. You know, the cancer word, whenever we listen this word, cancer, we all shake. Even not, it is not with the general public, I am saying, it is with the doctors also. When we come across if anybody is having cancer and we think the reports is pointing toward the cancer, we are also very disturbed for that particular patient. So cancer is, we all should listen carefully what I'm going to tell you today, that how this cancer, I will be taking through my slides, that how the cancer originates and what can we do to prevent it. So listen carefully. Before that, when I go to that, I'll just tell you that in the recent few years, we have you can say very advanced diagnostic modalities available with us to diagnose cancer at an early stage. But still cancer is in its rise. It is multiplying. It's every time the numbers are getting increased, especially in our country, the poor country like India, where we don't have that much of a facility that every poor get the treatment which is required for which is the cancer. The treatment is very expensive, and the treatment required, it shakes the entire family. If anybody is having cancer in the family, the entire family suffers. So with this lecture, I can say that with this talk which I am sharing with you, with my experience and my inside view of the cancer, which I am going to share with you, with this, I am sure that you will be able to uh, gain something about the cancer, and you will come forward to prevent it and to decrease the cancer load in our country, in our society. Cancer is a major problem. It affects everyone. It's like a thief which invades in our body, and it steals our health, happiness, wealth, everything. It steals everything. It affects everyone. It doesn't discriminate. It affects young also. It affects old. Even if whether you are a male or female, it doesn't discriminate. It doesn't discriminate whether you are rich or poor. It doesn't discriminate. It affects everyone. So it is very vital, it is extremely vital for us to know that what it is and what do people do to prevent it. So before that, I go on to detail about the cancer. I'll just let you know how our body is formed. Our body is made up of 30 to 40 trillions of cells. Trillions. Mind my word that these 30 to 40 trillions of cells are there in our body. It's like a community. It's like a community. You know, you have seen that house. The houses are built up of wall, and wall is made up of what? The brick. The brick you can consider is a cell in our body. It's like our body is also made up of cells like a brick. So when we have this much of cells, it is forming a community. We have a digestive system, we have a circulatory system, we have so many systems. There is a system like like a food processing machinery. We have a cleaning system. We have an army to fight with invaders, the bacteria and virus, and the army which is we call is the WBC, white blood cells in our blood, which fight against all the infections when bacteria or virus enters into our body. It fights against that. So what happens in the cell when it's causing cancer? Before that, I just want to let you know the normal nature of our cells. The cell keeps on dividing. We were born as a baby, and then we grew up as a full mature adult with the height which you have attained. Everybody has his own height, so height and weight which you have attained. So this keep on multiplying. These cells keep on multiplying. And even after that, when you have gained your height, everything that cells keep on multiplying, because there is always a you can say wear and tear in our body also, which requires to be healed, and the cell has to multiply. So what happens in cancer? So for that, I just want to think about you. Just think about the car. Just think about the car, and each cell in our body is like a car. Among these 30 to 40 trillion cells which I said, the each cell is like a car. So in car we have a brake, we have accelerator, and we have a fuel tank. Okay, so when your car is going very fast, what you do, you apply a brake, and when it is going slow, you press accelerator that it should go. And if your car is moving fast and your fuel exhaust, it will stop, it will not go anywhere. The similar way in our cell, you can say, if any cell among these 30 to 40 trillion cells wants to go rogue, then it is the brake. We have also having a brake system in our cell that is called tumor suppressor. So if the mutation is there in tumor suppressor gene, then it will not stop. So then it will keep on dividing and dividing. So there is, if that is not the case, then there is another set of gene called oncogenes, which is keep on pressing. It's like an accelerator. It's keep on pressing, and your cell goes on multiplying and multiplying and multiplying. So if this is not the only that, if this is not the case, then the third stop system in our cell is also like a fuel, which I said in the car, the fuel, if exhaust, the car will not go anywhere. The each cell, when it divides, the telomerase exhaust. In our body, these cells have a clock system. It is predefined that how many cells can divide, and ultimately it has to die. We all die. We all die in at any time. So it's like a cell is having a clock system, like a programmed, it is programmed for how many times it can divide, and if after that it has to go programmed cell death, what we call in our language apoptosis. So it will go on that. But what is causing apoptosis is telomerase, which it is going to be exhausted. But in cancer, it keeps on adding the telomerase. It make the cell like a solar powered cell kind of thing, solar powered car, which is moving because of the sunlight. As long as you have a sunlight, it will move. So it is like that. You can understand. So it keeps on adding telomerase, and then your cells keeps on dividing. Here I have tried to show it here that this is cell having telomerase at this end. I'll just use my laser. So you can see here, this is telomerase. Telomerase, when it is adjusted completely, the cell die, the healthy cell, and this is cell death. So cell dies, but in tumor cells, this telomerase keep on adding. There is a mutation in the gene of telomerase, and this keeps on adding, and cells convert into a crazy dividing cells, crazy signaling system, you can say, and that keeps on dividing. Cells keeps on dividing and creating its own group there. So if when this group is localized at one place, we call it as a benign tumor. It is localized tumor, and it is tumor we call any cancer we call tumor basically. So it is localized at one place, and it is called benign. it is very easy to tackle with, because we can remove the entire tumor, and patient can be all right after that. So but if it invades your blood vessels, it becomes like a seed. Any cell, any the part of it goes through the blood, and it may lose in your liver, it may lose in your lymph nodes, it may lose in your bones, anywhere in the body where the prediction is that. So it will go, when it spread from one place where it has originated and it going to the some other places, then it is called, the tumor has metastasized. And once the tumor has metastasized, then it is very difficult to treat. We have the when we then we can't remove the tumor, because wherever, it has gone to everywhere in your body, so we cannot remove that tumor everywhere, we cannot do surgery. So then we have the only option of chemotherapy and radiotherapy, and then mortality rate is very high. Ultimately the patient will have a very short lifespan if it has a metastasis. So it's also very important to get, even if you are prone for the cancer or you have developed the cancer, it is very important that you should get diagnosed early, so that you can be treated well. So anybody, this slide I have made for those who just want to know what is DNA and what is gene, basically where the mutation is going taking place. So cell, we have there is a cell structure. In the center we have a nucleus. We call it the nucleus. Nucleus is filled of chromosomes made up of DNA, and then there are genes. You just understand what is DNA. You have seen that in your city there are roads. So roads you considered as a DNA, and any street communicating with that road, you can consider it as gene. So in that way you can understand what is DNA, what is gene. So what happens, we keep on accumulating the mutations. And whenever there is a mutation, because I told you, we have a tumor suppression brake system in our cell, we have a accelerator oncogene we have in the cells, and then telomerase which exhausted, and then cell cannot divide. But if there is mutation in any of the three things, then the mutation will give rise to cancer. And we keep on increasing, accumulating the all sorts of mutation when we grow older. So that is the reason you must have seen, except a very hereditary cancer, that people get cancer when they become old. The majority of the cancer you can see at after the age of 50 only. So because we keep on accumulating, and this depends on various things which I shall be talking about in my further slides. So there are three ways of developing cancer. uh, One is sporadic. Sporadic means the environment where you live. The environment means what you eat, what type of pollution you are inhaling in that environment, what is your addiction habit, whether you are addicted to chewing tobacco, or maybe smoking, or maybe you are addicted to alcohol, and maybe your diet is unhealthy, maybe you don't exercise at all. This all can lead to a sporadic cancer. And you can see here the 70-80% bulk is due to your lifestyle. The mutation is going to help because of the lifestyle, and because the environment where you live. 10 to 15 cases are hereditary. Hereditary is the mutation had occurred in the parents, and that has been transmitted to progeny to its children, and this is 10 to 15%. So heredity, so somebody comes to my clinic, they usually, the patient asks me that, doctor, my aunt has a cancer, my uncle has a cancer, or maybe my mother had the cancer, do I will get a cancer? So it doesn't mean that if you have passed the hereditary pattern of mutation that you will develop cancer. This depends upon this factor also, the environment which I talked about. If you adopt a healthy lifestyle, you may not get a cancer. This is also important to know. And the third one, which we call is a familial. Familial is uh, when it is mixed, hereditary and sporadic. When it is hereditary and environment factor is mixed, then it calls the familial cancer. Here you can see a kid developing a cancer in the left side of the picture, cancer in the eye, in her left eye, called retinoblastoma. She had got it from the because of the parents has the mutation of that retinoblastoma gene, and then the kid has developed this cancer retinoblastoma in her early age of the life. Similarly, the colon cancer and the right side, I think this lady doesn't require introduction, but I'll just let you know this is Angelina Jolie. She's an American actress, and she developed the mutation in her breast gene, the tumor suppression gene, which is called BRCA1. That BRCA1, she had a mutation of BRCA1, and she got her both the breasts removed prophylatically, that so that she should not get the cancer. Just not because that she had the cancer, because she got it removed because she had developed the mutation in her tumor suppression gene for the breast, the BRCA1. So here I was talking about the sporadic one, the environment one. I have just given the here. You can see if you chew tobacco or you smoke tobacco in any form. If you're chewing tobacco, you are prone for your oral cancer. If you're smoking, you are prone for your lung cancer predominantly, and then even the bladder cancer. Even in the female, the cervical cancer. So many cancers are related to smoking, not only the lung cancer. uh, Alcohol also, if you consume alcohol in a very large amount, you may develop your uh, liver cancer, your gallbladder cancer, even your pancreatic cancer. Is a very deadly cancer, we can say, the pancreatic cancer. It's going on, it is increasing globally because of this bad habit of alcohol is being taken by everyone. Nowadays, everybody has is they feel that if somebody doesn't take alcohol in a party, he is not that smart. This type of concept has built up in our society nowadays. So consumption of alcohol and then making them addicted, because the young kids, they are before the 25 years of age, they are just indulge into the alcohol, and then they become addicted, because this is the age when they don't think of anything. They don't think of even when you'll talk to your kids, they will say, who wants to live for 40, 50 years? They say that 30, 40 years of life is more than enough, we should live that much of life, but the good life. They think that alcohol, drinking alcohol, and having a unhealthy diet is the life. It's not like that. If they will be aware of all these symptoms when very early, they might restrict all these things in their life also. So obesity, another, the obesity is the cause of all sort of cancer, I can say. It's the major problem nowadays. So obesity, take care of your weight, because it is going to cause harm in each and every system of your body. It will increase your blood pressure, it will increase your heart disease, risk of heart disease. It will take you towards the diabetes, developing diabetes. It will take you all sort of cancer. So diabetes, don't take it your weight very lightly. You have to be serious about for your weight. Pollution is one thing which can lead to, as I said, since you are inhaling these things, it can lead to your lung cancer. Infections, uh, any infection, so there are so many infections are there which are related to cancer, and specifically I will be talking about the infection is a human papilloma virus infection. Human papilloma virus infection is a sexually transmitted infection, and it is responsible for more than 90% of cervical cancer. Cervical cancer, I mean to say, it is in the female basically. The organ which uh, which keeps baby during the pregnancy is called uterus, and the lower part of the uterus is called cervix, and the cancer of that part is called cervical cancer. And when the female becomes sexually active, they are exposed to human papilloma virus, and this is the leading cause of death also in our India. And the good news is that we have a vaccine for this human papilloma virus vaccine to prevent from the cervical cancer, which I will be talking further in our in my slide. Sun exposure, if you have a uh, very much exposure of ultraviolet rays, it can lead to cervical cancer. And inherited, I have already talked about that. So what we should do, because 70 to 80%, as I said, is sporadic cancer, which is due to the lifestyle which we live, is due to that. So keep yourself active, do some exercises, which will I'll be talking about in my next slide. Take your healthy diet, avoid all junk food. We are all indulge into these sort of things nowadays, that we eat. We like burger, we like pizza, but don't make it your main diet. You have to learn that you should eat green leafy vegetables. You should eat those vegetables which have much more antioxidants, like broccoli. All these things have antioxidants in it, so you should eat those things. So people ask me, what should I take in diet, what vegetable I should take. I say that you take any green vegetable, whichever you like. At least 5 servings every day of vegetable is required. Eat as much salad you can take. Salad is good for your health. It contains a lot of fiber also, so you have to take high fibrous food, so that you should not develop colon cancer or anything like that. So try to take a healthy diet. Include fruits in your diet. Fruits, I'll tell you that all the berries are very good. Whether it's a strawberry, whether it's a raspberry, whether it's a blackberry, whether it's a blueberry, all the berries are basically anti-cancerous. So these are good to have. But you can take another fruit also, and I don't say that you don't take other fruits. So apple is also good in that, with orange are also good. So fruit, you must include fruit in your diet. You must include vegetable in your diet. Avoid oily foods. Avoid red meat. Red meat is the cause for colon cancer. So red meat, you should avoid the red meat. Chicken is good, fish is good, but then not very fried one. Fried items should be avoided. If you want to take meat in the form of chicken or fish, take the roasted one. Roasted one will be beneficial for you. And avoid taking red meat, avoid taking oily foods, avoid taking cheese, much more cheese in your diet. Keep your children educated about all these things, that they should not develop in these habits. Make food in your home. The fresh food is good for your health, so make food in your home. Try practice to having a home cooked food. Stress is the major factor. Stress is the one thing which has been emerged as a leading cause of cancer also. So stress, what does stress does? Stress, it increases your blood sugar. It releases lot of hormone from your body, glucagon, catecholamines, and cortisols. These hormones are being secreted when you are in a stress, and this raises your blood sugar. And once blood sugar is raised, your insulin will be secreted more, and this will cause harm. This will lead to your inflammation and development of cancer. So there will be increased inflammation. Your digestive system will become sluggish because you had a stress. So you will be having constipation. You will feel that your food, that you don't like to have a food, or somebody in the stress become very cravey about the food also. This is also the things because of some hormones. So your immunity decreases because stress, every reaction, every action in the body by the cell has been reduced. So your immunity also decreases. So I'll just suggest you, leave your stress. Little bit of stress is okay. When you have exam, suppose your kid has exam, little bit of stress will be there, because that is a natural phenomenon, that you will have a stress. You have some visit in your office, or your some supreme boss is coming, you will have a little bit of stress. That is agreed. You have some pressure to produce results, you will have a little bit of stress. But don't be let you sit the stress on you. You leave your stress outside the home. When you enter in your house, you try to learn these things, that whenever you are in a stress, you leave this stress outside your main gate of the house, and then you enter into the house. Because when you will be in stress, your family will be in stress. So you are not only causing harm to your body, but you are causing harm to your entire family. So try to learn how to decrease your stress. There are so many ways. Try to do some meditation, go for walking exercise. Is also in releases a lot of hormone which decreases your stress. So what sort of exercises we should do? people ask me that what should I do in exercise. Some people, some they ask me that, I don't have time because I go to the office very early and I come back very late. I don't have a time to go for exercise. And then when I ask them, what do you do on you, he says that I goes to the office Monday to Friday. What do you do on Saturday, Sunday? Saturday I wake up very late because I keep on sleeping, and Sunday I relax. So you don't have time basically. So you have to learn, you have to take out some time for your exercise, and any exercise is good, but I generally say that any brisk walking, or if you are in an age that you can jog, the jogging is good, jogging is good. And if you can jog, if you can run in that age, if you are there, and if you are older, then you go for a brisk walk, and at least 30 minutes in a 6 days in a week, 30 minutes 6 days in a week. And this will, what it will do, this will your consume your blood sugar which is available in your blood, and no need to secrete insulin, because your body is working very hard, working very that time working more to provide you the energy, the fuel. They require a fuel in the form of glucose. So it is coming, it is already there and it is being utilized. So insulin has been known as if there is an increase in insulin, this leads to cancer. So exercise is good because it will decrease your insulin, other hormones also. It will decrease your stress, and it will increase ultimately your immunity, because your every cell is now tuned up. So now when your cell is tuned up, you are not very prone for any infection, or for that matter for developing cancer, that developing mutations. So there are three cancer. I have shown it here. They are preventable cancer. The good news is that we can prevent them, and the leading cause of death in the India is now the cervical cancer. And as I said earlier, also in my when I was talking to you about the cancer, that this is caused by 90% of this is caused by human papilloma virus infection, and which is sexually transmitted infection. And whenever the girl is sexually active, they are exposed to this type of cancer. So there is a vaccine called HPV virus vaccines, and this can be this I will be taking you in details for that cervical cancer, because we can prevent it by the vaccine also. And the breast cancer, we start program of screening it. There is no vaccine for that, but we can screen this. Whosoever having a risk, suppose. In the family somebody is having breast cancer, or they have a you got it diagnosed by the blood that you have a mutation in your tumor suppressor gene, or something oncogene, or anything for that matter, which I talked earlier. So then you should go for mammography more frequently, and mammography at least should be started at the age of 40, and every 2 years you should go for mammography. And after 15 years you will be required to go yearly for mammography. Mammography is a scanning technique, and by that we come to know that is there any development of mm, that cancer cell is there or not. And similar with the colon cancer, if you have a family history of colon cancer, you should come forward. And even if it's not there, then also at the age of 50, you can go for colonoscopy. Colonoscopy is a visualization of your colon, is a part of your intestine, and under the general anesthesia, it is being visualized um, by the surgeons, and they see it, whether there is any development of cancer is there or not, or if they find any alteration in that mucosa, they take out of the sample also from there for checking of that if there is any probability of developing cancer. So these screening programs are available with us. So screening test, as I have suggested. They asked me that what are the symptoms of cancer? How will come to know that the cancer I am developing the cancer? Cancer does have a symptom relating to the system where it has been developed. But there are some common symptoms also, like unexplained weight loss. Unexplained weight loss is there, and you become tired very easily. There is a tiredness, and you have your hemoglobin is decreasing. Like if you have a colon cancer, you will feel that you will feel constipated. Even if you want to go to the toilet, and then you'll go to the toilet, and then you may not pass anything, but you will have a desire to pass, because the whenever there is a stool accumulated into the rectum or anal canal, there is a tendency that you feel urge to pass it. But what is happening, there is a cancer mass sitting over there, that is not a stool, and you have an urge to pass, and there is nothing to pass because this is attached to the wall. It is a cancer, it is a cancer which is attached to the wall, so it cannot be passed. So uh, you can say that you will be going to the toilet very frequently and you may not pass it, or you may pass just only the blood, and you may pass a black tatty stool because the blood is oozing from there, and when it is passing through such long distance of intestine and coming into the toilet, then it is not like a fresh blood, then your stool becomes black. So these are the symptoms. If you have lung cancer, you will have cough, or you have a difficulty in breathing, all sort of things. You will feel, if you have a breast cancer, you feel that there is a tightening of skin, and there is a swelling in the breast. So all the depends upon the system where actually the cancer has arisen. So for cervical cancer, what I was talking about, we have a preventive vaccine also. So there are two tools for preventing this cervical cancer. We have a human papilloma virus vaccine, which can be given between 9 to 15 years of age, 45 years of age. So and after 21 years of age, we start screening for cervical cancer by pap smear. Pap smear, I'll let you know in my further slide what is pap smear and how it is being taken. So cervical cancer vaccines is a very easy vaccine. It's a simple shot given to your arm. It's even less painful than injection which you take in your arm. Any injection which you take in your arm, it is rather less painful to that injection, and you cannot feel. Sometimes the patient doesn't feel that the vaccine has been given also. So this is a very safe vaccine also. And two types of vaccines are available in the market. We have Cervavac, which is a India-made vaccine, and the strain which is contains that there are four strains. The 16 and 18, these strains are actually responsible for causing cervical cancer. And for the less extent, the 6 and 11 also causes cancer, but cervical cancer basically is caused by 16, 16 and 18. So it is a cheaper vaccine because it contains four strains only. And we have another vaccine called Gardasil 9, in which there are nine strains of human papilloma viruses are there. And why there are nine strains have been added, human papilloma virus is not only causes cervical cancer, it can cause even the oral cancer, it can cause even penile cancer in the male, it can cause your wart, genital warts. It's a cauliflower like growth on your genitalia. This is caused by human papilloma virus. So this is costly because it contains nine strains of viruses, and it protects all sorts of human papilloma virus cancers. So this is the benefit of Gardasil 9. And if you really want to go for just for cervical cancer prevention, then Cervavax is a good option. And for this vaccine, I'll tell you, it has a very somebody. They don't feel any reaction after the vaccine has been taken, but some may feel that there is a swelling, there is a redness over the vaccine site, and somebody may have a mild fever, somebody even may have some nausea sensation, and somebody even may have a fainting sensation, this also. But it's comparatively a safe vaccine, it doesn't cause any harm basically. So screening. Before that, I just want to let you know that this vaccine has been given. Two doses of vaccine is given between year 9 to 14. It is better if you can give vaccine early. Before the child is exposed to any virus, getting virus. So it's better to give them early in their life. So 9 to 14 years age, two doses are given, zero point 0.5 ml. First dose is given, we count it as zero, and after that, between 6 to 12 months, the patient has to take the another dose. And then after 15 years, 15 to 45, you can say you require to be given three doses. And then the first dose will be zero dose, and then after 1 to 2 months will be your second dose, and then between 6 to 12 months you can go for another third dose of vaccine. So even if you are vaccinated, Vaccine gives you more than 95% protection, but even if you are vaccinated, you must go for a pap smear examination, because this give you a early diagnosis. When cervical cancer is diagnosed, if you have not gone for pap smear and you come with the symptoms of cervical cancer, like postcoital bleeding, or bleeding infrequently in between the menses, or dyspareunia, like having pain during the coitus, all these things. So if you come during that period, it might be possible that your cancer has already invaded the nearby structure also, and it has already gone beyond that. So it will be difficult to treat. So it's the best is that you should go for pap smear, and even if you are vaccinated, you should go for pap smear, and this will give, if there is any changes in your cervical mucosa is there, then then you can be diagnosed early and you can be treated well. And here in the diagram you must be seeing that that is a very complicated one, but I'll say you that this is not very complicated procedure. It's very simple procedure. And pap smear, the advantage is that you will go to gynecologist clinic, and that she will be taking this sample, and she will be able to visualize your genital part, the private parts, and she will be able to see a lot of things apart from that cervical cancer also. So it's better to go for once in. It is required to be given once in 3 years for pappies after the age of 21, and then during that visit, she takes a sample from your cervix and sends it for the examination if there are any changes is there. If there will be changes, then you may have to go more frequently for a pap smear examination. Maybe not on every 3 years, but maybe before that. But it doesn't mean that if you have a changes in your pap smear you will develop cervical cancer. It's not like that. you know there are things that sometimes due to some infection also the changes are, those similar changes are there. When you go for next time, it is not there. And if the changes are there and the pathologist and doctor combine the things that it is carcinogenic one, then the treatment can is very easy treatment that time. The simple surgery can prevent you from developing this cancer, and you can live a normal life. So if you go for another test called HPV DNA test, HPV DNA test, we recommend female to get it done with a pap smear examination. So if you have got your pap smear and HPV DNA test then done, then you require to go on every 5 years for pap smear or HPV DNA. Not required to go, because if your HPV DNA test is negative, then 5 years you do not require to go even for pap smear also. So with this I hope that I am able to convince you that how the cancer originates and what action we should take, that we should not develop cancer in our life. And even if you are prone for cancer, even if you are having a genetic history of cancer, and even if you are not taking a very healthy lifestyle, and then also if you go for early diagnosis of cancer, the survival rate is very high. Once it is decimated, once it is metastasized, when it has gone into the higher stages of the cancer, then it is not only difficult to treat, but you can say that even it is a financial loss. uh, a cancer ruins the family. you know in India, there are treatment are available in the government hospital, but there are a lot of rush is there. You will be running here and there for your treatment, and even the private, if you will go in the private, then your expenditure will be much more. So why to go for all these things if we can prevent it, or if we can diagnose it early and get it treated immediately? So that increases the survival rate. And together, if we will work together, if you come forward for your early diagnosis, come forward for your prevention, then we can increase the survival rate in India also. But India, it has been seen in decline in survival rate, because we have less resources available with us, and less awareness is there about the cancer in our society. So I request you all to play a vital role by by participating in this, simply by promoting awareness. You can promote awareness. If you are today, if you have learned something about the cancer, just promote it about what are the measures to be taken to reduce this cancer. So if we will be coming forward as a society to give awareness to the people about the cancer, we will be able to make more survival rate. We will be able to decrease its incidence in our society. One thing more, I just want to add for cervical cancer. If you can give a gift to your wife, or to your daughter, or to your sister, or to your mother, you can gift a vaccine. This is nothing like that. Yeah, giving them a protection from a deadly cancer is a good gift for them. So I recommend you that you must come forward to get your sister, daughter, mother, wife, whosoever is there. So get them immunized for this cervical cancer, with cervical cancer vaccine. And one thing more, if you can just give a thought of that, which I usually feel I give a thought to in this also, because we are living in a very poor country. India is a very poor country, and in our home the maid are working. The poor lady is working with us, and give them awareness about all these things. And if you can even give the vaccine to them, because they cannot buy the Sarvabhaik also is costing roughly about 2000 rupees. So this 2000 rupees is much more money for them. Uh, they are earning in a month this short of maybe in 10 or 15 days they are earning just 2000 rupees. For them it's a high money, and it's not a free of cost available in our country, that they can get this vaccine from the government hospitals. It is not like that. And if unfortunately they develop this cancer, they will not be able to get themselves treated, because they will be lost in government hospitals. They cannot go to the private hospitals. So if you can give to your maid also this vaccine, this is nothing like that. You can prevent at least one cancer, which is preventable. So I request you all to give a thought on this also, and make awareness, spread awareness about the cancer. And I thank you all for the opportunity given to me. Thank you very much.
Thank you so much, sir, for making us understand about cancer and mention such valuable points for us. Now we'll be starting our question and answer round. So I'm requesting all the participants, if you have any questions and queries, you can start sharing it in the chat box section. We'll discuss about it in detail here. So meanwhile, sir, we have a few questions shared during the webinar. Let's start with these questions first. So the first question here is, how smokers can protect oneself or minimize the risk of cancer?
Uh, the question itself is the answer, I can say. Uh, you know, uh, if you are smoking, you have to quit smoking. Simple way. If you the thing which you are taking, that it is going to harm you. If you will not stop that thing, how it will how it will reduce the chances of developing those things which is causes. So you have to stop smoking. You have to have a willpower for not to smoke. There are so many programs running in Delhi also, and all over India, that for quitting smoking. So go for those programs if you have motivated, and don't smoke. And if you are addicted to that, they will help you out to get rid of this bad habit, and they will help you to quit smoking. So must join those programs also.
Thank you, sir. So there's one more question. Is cancer can be completely cured by the medicines only?
See, it depends the stage of the cancer. Cancer can be completely cured also. You can live a very the life which is expected to live by you. The whatever the God has decided, whatever the God has given you, the life cycle of your cells in your body, you may live that much. You may live that much. You know, but the thing is that if you can be diagnosed early, then it can be treated very well. Like I said, I told you that cervical cancer also. there is a prevention vaccine. If you take prevention vaccine, if you go for pap smear, and if, even if after that, if unfortunately you develop and you are going in a pap for pap smear and it has been seen early, and then very small chunk of that tissue is required to be taken, and when it will be taken, then you are as good as other healthy persons are there. So it depends upon what stage your cancer is. So I'll tell even the almost all the cancer can be prevented by the lifestyle which I said, by the diet which I have said. You can protect your cancer risk of developing cancer, and not only that, like oral cancer. If you have some changes in your oral mucosa, if you go early, this cancer can be removed. There are very few cancer, as I said, the pancreatic cancer is very notorious one. There are few cancer which are even at early stage. They are very you can say they are not very good cancer for the treatment. But how many of us are developing pancreatic cancer? If you will not smoke, you will not take alcohol, you will not develop it. You will not develop it. You will not have that mutation. And if you are living a healthy life, if you are taking a healthy diet, you even if there is a little mutation, you will not develop it. So of course there is a treatment for cancer, but if it is diagnosed in the early stage. Thank you.
Okay, sir. Thank you so much. So there is another question here. Is there any age limit that beyond this age we cannot get vaccinated for cervical cancer?
Yeah, as I said, it is recommended up to the age of 45 only. Beyond 45, you it is not beneficial to take this vaccine. But still, there is a there even if you are not vaccinated, as I said, uh, to protect from the cervical cancer. So then if you go for pap smear, you can be diagnosed early and you can be treated well, as good as if somebody has taken cervical cancer vaccine or not. But thing is that if you are developing that thing, cervical cancer vaccine, if you have taken, then you will not develop cancer at all. But in the pap smear, you will get your early diagnosis of cancer, even if you are not vaccinated. Our elders, like our mother, and they that time it was not that awareness that vaccines were not available, so they didn't get it. But that doesn't mean that every that old lady will develop cancer now. The thing is that they should come forward for pap smear, and if they get the pap smear HPV DNA test done on every, they are going together with that pap smear HPV DNA test. That every 5 years they can go for that. If there is any changes, they can go more frequently, and then they can stop developing. They can prevent from developing this cervical cancer.
Thank you so much, sir. So there is one more question. Is it true that vitamin D can be cause of cancer if we take it in an excessive amount? Because there are several supplements and vitamins are available in the market.
Which vitamin? Vitamin D.
Vitamin D.
See, vitamin D per se causing cancer is not there, but of course, if you will take vitamin D, much more quantity is harmful. Vitamin D, vitamin D is basically a fat soluble vitamin. Like vitamin A is also fat soluble vitamin. Vitamin D is also fat soluble vitamin. Vitamin B, C are water soluble vitamins. They are soluble in water. So they what happens? If you even if you take much more vitamin B and C, it clears from the urine. But this accumulates in your body. Vitamin D, vitamin A accumulates in your body, and it causes lot of changes in your body. Lot of changes in your body. It causes even fall of hairs also. Vitamin D, if you take much more quantity, hypervitaminosis D, a symptom which can cause. So anything excess of anything is bad. I can say excess of anything is bad. Take as per the as per recommended by your doctor, or if you have any query for that matter, I'll just let you know that we are 24 into 7 teleconsultation company known as MeraDoc, and our doctors, very accomplished doctors. We have a group of doctors with us. They are very good. You can contact them anytime. They are available 24 into 7. And if you have any query, they can make you understand. If you have any concern, they will treat you very well. So try to contact them whenever you have such doubts. And access of anything is, again I'll say, is bad. Don't take anything in access, and unless until it is advised by your doctor. You don't take as a over a counter medicine, whether it's a vitamin, whether it's a minerals. uh, stop this habit of taking over the counter medicines. Over the counter medicines are harmful, always harmful, whether it's a vitamin, whether it's a mineral.
Sure, sir. Thank you so much. Okay, so there is one more question. Can cancer spread from one man to another by touching and eating food together?
No, 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 no. This is not contiguous. This is not contiguous. Be sure, be assured. Cancer doesn't spread by taking food together and by touching. Even for that matter, HIV doesn't. Even HIV also taking food together in a same plate or shaking hands. It doesn't spread. Even HIV doesn't spread. There are for to having a cancer. If you have listened my lecture carefully, for having a cancer, there are three systems. I told you. I have given a beautiful example of a car. That is, in the car we have a brake system, we have an accelerator, we have a fuel tank. Similar way, the cell is a you imagine our cell like a car, and we have a brake system called demon suppressor. We have an accelerator called oncogene, and we have a fuel tank on telomerase. And all these things are required to develop a cancer. The mutation is required, and when mutation will be there, if you have no, you will not have live a healthy lifestyle. These mutation will keep on accumulating, and you will be developing cancer later somewhere in your life. Somewhere maybe after the age of 50 or somewhere in your life you may develop cancer. So I can say that by touching and by taking food together, be assured cancer never spreads.
Okay, sir. Thank you, sir. So this next question here: how we can save ourselves from cancer as we live in such a polluted city such as Delhi NCR, where we literally breathe polluted air.
Very good question. Uh, See, we are in a poor country. We don't have much more choice with us. And if we are living in a community where there is a pollution is much more there, and we can help in the other ways. If you have gone through my what I talked about the cancer today, if you have remembered those things, that sporadic cancer, the way of developing cancer, the sporadic, the environment one, contributes 80 to 90%. This only not only include the environment, this includes your dietary habits, this includes your exercise habits. So we know that we are living in a polluted city, we are living in a polluted country. We are not in a England, or we are not in America, we are not in a developed country, but we are breathing a fresh air. So then what we should do, we should, in USA or UK, they have zero pollution, you can say. Or three API is there in England, basically. But they have a bad food habit. They don't have a good food habit as Indians. So if in India we can develop a good food habit, we can take a nutritious diet, we can take a healthy diet, and we can exercise more. If you think that pollution is much more, as I said, you should go for walking for 30 minutes, go for 1 hour, go for 1.5 hour. Okay. If you'll exercise more, if you'll make more active, take less stress, take fruits, take vegetables in your diet, eat less chapati, eat less rice, doesn't matter. Don't eat junk food, don't go for oily foods, don't go for red meat, and exercise yourself. Even if you are living in a pollution, I assure you that you will live a same life which the other developed countries are living. You will have a same life. So don't be disappointed by that we are in a polluted city. But other factors which we can control, we should control to minimize the risk of developing mutation in our gene. So if we'll minimize the risk of developing mutation in our gene, we are not going to develop cancer.
Sure, sir. Thank you so much. This next question here is: can one need PET CT to diagnose any starting system?
Can note, yeah, what you said.
Can one need PET CT to diagnose any starting system
No,
symptoms? Sorry.
see, don't go for PET CT for as your own. I can say, you know, PET we get it done. I'm not saying that we don't get done the PT in case of PET scan in case of cancer, but that is for some other purpose. first you should be diagnosed that whether you are having a cancer, whether the symptoms should be there, and you talk to your doctor. You talk to us 24 into 7. I said I am. We are available on MeraDoc platform. You talk to us, and as per the recommendation of your doctor, mm, go for PET scan, because PET has also the exposure of radiation exposure. So if you don't require PET scan, just for the sake of that, you just want to get yourself scan done with IMW cancer. This is not the good practice, you know. And there's something this is required to be which investigation you should go. It should be decided by the doctor, not by you yourself. Because why I'm saying so, because you don't have that knowledge in this field. There is a person sitting in this field who has this knowledge. So talk to them, have trust in your own doctor, have trust in doctor, and you will be advised accordingly. So don't go for pit as your own. But of course we get it done for some other purposes when the cancer is diagnosed.
Sure, sir. Thank you so much. The next question here is cancer can be from genetic, that is from parents to kids?
Yeah. Cancer. I explained you. We have three types of cancer. One is the spotting one, which is related to your environment, and the one is the hereditary, the genetic one, the mutation your parents had, and that has been passed to you. And the third one is familial one, which is combination of all those that sporadic environmental and hereditary pattern. So of course there is a genetic factor involved in the cancer. If you have a genetic predisposition, you may develop cancer, but it doesn't mean that you if you have a cancer in your family that you are going to develop cancer. It doesn't mean, you know, you can modify your even the mutant gene which you are carrying. You can modify, you can suppress it by the again the same methodology, that you have to stick on your diet, you have to be active for the exercise, you have to take less stress. And these things if you are taking, there are chances, 99% chances, that even if you are inheriting the gene, you may not develop cancer. But yes, if somebody is inherited genes, the risk increases for developing any cancer, for developing cancer.
Sure, sir. Thank you so much. There is one more question which we are taking. Uh, Refraining from consuming sugar can enhance our ability to combat cancer cells more effectively.
Good question, Rahul. I think, sorry, good question. I think uh, sugar we should restrict. Sugar is the one thing. If you are take much more sugary diet, you know, you are getting insulin released from your body. And as I said earlier, the insulin is the one which is involved in causing cancer, causing mutations. So much more insulin release in our body if you are taking much more diet. uh, Say you require to eat two chapatis, but you are taking 10 chapatis. Okay. So you are accumulating things. You are causing insulin to be secreted. Similar way, straight way you are taking sugar, which is causing insulin to be released. So if you restrict your diet or sweet diets, then you are minimizing the chance of developing any cancer in your body. It is like that. So sugary items are actually responsible for causing cancer, no doubt about it.
Sure, sir. Thank you so much, sir, and thank you so much, everyone. As we have so many questions coming up, but since we have a shortage of time, so it will be difficult for us to take all the questions. So, for those whose questions remain unanswered and wants to get the answer of their questions, and everyone with their health-related queries, feel free to reach out MeraDoc through our website www.meradoc.com, and you may also contact us on our toll-free number 180030901001. We will be really happy to assist you. And with this, we come to an end of the webinar. Once again, thank you so much, sir, for this amazing session and all the participants for their support and presence. Thank you,
Thank you
everyone.
very much. Thank you very much, Vansika, and thank you everyone for giving me the opportunity to be a part of cancer preventing society. Thank you very much.